items, so we'll get right into the discussion items. The first item, there's a 5-minute staff presentation. It's on the collaborative decision-making agreement on KW4, the Ontario Health Team. So I believe we have Ms. Larian Palibeski and Dr. Joseph Lee for this. Ms. Palibeski, I understand you're making a presentation.
Hello, am I here? You hear me now?
You're here when you're ready. Thank you.
Okay, sorry about that. I'm not sure. My teenagers are doing their homework, so I apologize for the internet connection. Okay, I will start again. So I will provide a brief introduction before I pass it over to Dr. Lee. And I apologize, as I lost my signal there, I lost my report, but here it is. So we're here before you today to seek support in moving forward with the collaborative decision-making agreement with the KW4 OHT, Ontario Health Team. And essentially what we're asking is that Kitchener become a strategic member of this team, as well as approval for the funding for 2020 and 2021, which is $25,000 a year, $50,000 total. In the report, I tried to provide an overview of sort of where we've landed, but as you might remember, in early 2019, the province signaled a kind of a new approach and model for our healthcare system. And since that time, community stakeholders, healthcare providers, advocates have come together to plan for what this model might look like in our own region. And the total goal was really to create a collaborative, co-designed model that reflects the geography and the diversity of our community. We were able to put together a proposal in October 2020 to the province and was subsequently approved in November 2020 as a health team for our region. In the first year, I think what's important to note is that there will be four focus areas. One will be on COVID-19 preparedness and response. Second, homelessness and precariously housed, the frail elderly, and refugee health and wellness. And while I know that as a municipality, our sort of role and mandate in the health space is smaller than, in the hospitals, but I will say our role from an upstream prevention perspective is really, really vital. When we think about the investments we're making in recreation and leisure programs, in our neighborhoods, in our community centers, we know that all this contributes to the health outcomes of our community. And this is a big opportunity for Kitchener to participate in the strategic planning when we think about health comes for our community. And it will help us ensure that the trends and needs of our residents are brought forward as we're planning. So with that, I will pass it over to Dr. Lee.
Welcome. Thanks for having me. My name is Joe. I'm a family doc. I've been in Kitchener-Waterloo for 32 years, along with my wife, who's also a family physician, and I'm a resident of Kitchener. I don't know, Lori, if you were going to share. I saw you had a PowerPoint there. Oh, I guess Sarah is sharing it. Thank you. And so, yes, I'm Joe. You can go to the next slide. I'll just go through this briefly because Lori said a lot of things that need to be said. The Ontario Health Team has 4 principal goals. One is to improve the experience for people and their families. It's to have better outcomes for our population, to reduce cost and have better experience for the people who provide care. And the Ontario Health Team has providers who are clinically and fiscally accountable to each other. We're delivering continuum of care across many sectors: hospital, primary care, palliative care, home and community care, mental health and addictions, and so on. And the attributed population is within a geographic area course, KW4, the K in KW4 is Kitchener. Next. So as mentioned by Lori, there was this timeline. We've been working at things for about a year and a half. And even though we've been unofficially working as an Ontario Health team, certainly through the pandemic, we have been officially approved recently. And next is fine. So of course, KW4 includes Waterloo and the 3 W townships around us. The population is about 400,000. And this is really for the health of the entire population of this area. Next. As mentioned by Lori, there is a focus on the pandemic, on COVID-19 for sure. And we are targeting some of the most vulnerable populations that we have: the frail elderly, refugees, the homeless and precariously housed. And we're extremely excited to have the municipalities and also our academic institutions like the University of Waterloo involved, because as Lori mentioned, this is an opportunity for us to tie healthcare into the real determinants of health, which are largely the social determinants of health. You know, so your work with recreation and neighborhoods and community centers and so on is vitally tied to many of the things that that there's a focus on with the Ontario Health team here in KW4. Next. This was mentioned already, and it's these vulnerable populations will act as an excellent template on how do we care better for everybody and promote wellness with everybody in KW4, the entire 400,000 people. If we can do it for the homeless and precariously housed, how do we do that for all of us all together? Next. So we have adopted the Wellbeing Waterloo region's community aspiration as a vision and looking at it through a healthcare lens. We're valuing partnerships with people, their families, caregivers, the community. We want this to be extremely inclusive. I reiterate about being looking at it very broadly, including the social determinants of health, trying to have it be nimble, innovative. We feel like in KW4 we have, by having strategic partners like the municipalities, this is, I think, very exciting for us in healthcare. And a lot of these are built on relationships and a culture built on empathy and trust. Next. Again, even though we're accountable to the Ministry of Health, we're working collaborative with agencies that transcend and are outside of the Ministry of Health, including social agencies. Next. People, their families are at the center of this, and we're trying to surround them with care, primary care, mental health, addictions, public health, social services, hospital care, home and community care, palliative care, and so on. And digital health is actually a big enabler. Thanks to the pandemic, a lot of forward movement on that in healthcare. Next. As I say, we've been working at this actually quite a long time, the last 18 months, and have synthesized a lot of the operations for the Ontario Health team. We do have partner members. We have more than 30 organizations in KW4. We have some affiliate members as well. And we're looking for the 2 cities, the University of Waterloo, to be type of strategic partners for us. Next. Lori mentioned kindly about the collaborative decision-making arrangement, which is specifically the agreement among the strategic, and member partners. Next. Regardless of being a partner or a strategic member, we hope all of the organizations share the vision and work collaboratively to make these decisions, working together really for the good of the population that we serve together. Next. So, didn't really have much else to say. Lori said it really well, so I'm here to answer any questions if anybody has any.
Thank you very kindly for your presentation. There are 4 people in the queue. I apologize, Councillor Gazzola and Councillor Marsh queued in at about the same time. Is either of you aware who was first? Councillor Marsh? Okay, go ahead.
I think I was first. So yeah, I would like to just commend you on this work. It's really vital, and it's exciting to see it come forward here today. I want to know from the user's experience who are currently receiving care, whether it's through personal support workers or, you know, all the different care providers that offer care, how will they see this change, if at all?
Yes, yeah, that is important. Perhaps people won't know it's Ontario Health Team work because, you know, people really couldn't care what we call it. I think a really good example is particularly through the pandemic, have been a lot of our homeless and precariously housed people in downtown Kitchener would be a very good example. Those people are highly vulnerable. COVID-19, we were really worried that would rip through that population. And, you know, there are a lot of good people working, you know, some of our partners at the Working Center and House of Friendship and Ray of Hope and so on have organized really well. You know, there was the Radisson Hotel who stepped up, you know, lots of people with the municipality to really care for these people. In fact, people would say, you know, although we have a long way to go and a lot of exposure of the work we have to do, a lot of good work has been done. In fact, from a healthcare point of view, some of those people have been checked in and received better care than they probably have in years, quite frankly. And they may not say Ontario Health Team. In fact, I'd fall off my chair if they did. But, you know, they really have been checked in better than before. And you can see that actually, you know, from a healthcare end of it. Less of them are winding up at the hospital or in the emergency room.
Right, which is wonderful. So, okay, and then some people are receiving like the category of that you call the frail elderly. Seniors receiving care at home, are they being served by the LHIN or by your group, or how is that going to transition still?
Right. So, you know, it's not like anybody's stopping their current work. So the hospitals will still do their own work and primary care and so on and so forth. You know, some of the exciting work, maybe I'll toot my wife's work. My wife is Linda Lee. She started 117 memory clinics in the province. And so people with dementia or families who are affected by cognitive impairment like that, it's a way that actually has been shown through a lot of evaluation. It decreases hospitalization, keeps people at home better, delays admission into a long-term care facility, and it's something which decreases the cost for the average person by $26,000 per person per year, because they're not going to hospital and long-term care. And this is a made in Kitchener-Waterloo product, which we're expanding in this region, and we're outreaching more to the rural areas around us because it's harder, you know, if you live in New Hamburg than you live in Kitchener, as an example. You know, but this would be a tangible example of what we're trying to do. And I would say we're trying to identify the frail elderly so we can target who should go for those exercise programs more so. Who should we connect up with more social services more targeted, and so they're not so isolated. Those would be examples of
Okay.
work that's being done for frail elderly.
Okay, thank you. Chair Davy, at the appropriate time, I'd be pleased to move this motion. Thank you.
Very good, thank you. Up next, Councillor Gazzola.
Yeah, thank you. I'm trying to understand what this organization is. It's something different. I'm not familiar with it. Are the LINs still in operation?
If you want a short answer, the short answer is no. There's something now called Ontario Health, which is you could say like a mega agency of many organizations province-wide, and the LINs have been absorbed into that. The Ontario Health Team is not a new LIN. It is taking some of the functions of the LIN in a certain sense, because who is the OHT, the Ontario Health Team, around here? It's actually us. It's the hospitals, it's the doctors, it's the social agencies like House of Friendship, and it's like the city of Kitchener. It's us working together, sitting down and working out how do we help people better. I don't know if that answers your question.
No, that helps, but it's a little confusing. So the Ontario Health Teams are replacing the LIN?
Well, the LINs are gone. It confuses us too. So I wouldn't blame you.
Okay.
I work in
Do you have a board of directors?
We have a
Who do you answer to? Who do you answer to?
The Ministry of Health, the Ontario Ministry of Health.
Okay, so there must be a board of directors for this area, for this Ontario Health Team?
We have a steering committee. It's not a board of directors.
Will it ever be?
It's more a collaboration among these 30 some organizations, as opposed to, it's not a corporation, so to speak.
But you have an organization here that has to answer to someone. Who do you answer to?
To the Ministry of Health. Ontario Ministry of Health.
Okay. All right, it's still a little foggy to me as to what. We're a strategic member. Who are the partner members?
Right. So the two hospitals, so Grand River Hospital, St. Mary's Hospital, the Center for Family Medicine Family Health Team, the Downtown Kitchener CHC, Community Health Center, the House of Friendship, Ray of Hope. There's a long list of about 30 of us. So if you think of any major health agency or social agency in KW, it's in.
Okay, does the Ontario Health Team have a staff?
It has a current staff of 1 full-time employee, and the rest of the staff are seconded by organizations like the hospitals or the Center for Family Medicine. So it's through this agreement where we all contribute people to the cause together.
Yeah, I really wonder about the governance of it, how this works. You say you have a staff of 1 today. Do you have offices? Do you have an office?
The offices are at our organizations. So we use the Grand River Hospital, St. Mary's Hospital, the Center for Family Medicine. We use existing offices to do the work that we have to do together.
Who is there a president of this organization? Is there who calls the shots or what?
Right. So there's a steering committee.
I still don't understand. Pardon?
Right. There's a steering committee. The steering committee was chosen by the 30 plus organizations. That provides the leadership to these organizations. I chair that steering committee. Among other people, there's 10 people on that steering committee representing cross-sectorally the members of the Ontario Health Team. So there's no
Okay,
president.
a steering committee normally gets set up to organize something, but eventually the organization has to end up with some kind of governance, with some kind of president, some kind of management. What kind of budget does this organization have? You're asking for 50,000 from the city of Kitchener. This is a new expense for us. The city never had to pay anything to the LHINs directly. So what is this organization you're asking for selling for this year and next year, and what happens the year after? It seems I'm not questioning the need for this sort of thing, but where does it come from? Where's it come from? Where's it going?
If I can just interject for 1 second, Councillor Gazzola, I'm going to get you to queue back in if you have more questions, but Dr. Lee, if you want to answer the question. Thank you very much.
Yeah, sure. So I would say the current budget for the Ontario Health Team for the year is about $1.5 million, though it actually orientates the strategic plans of all the organizations. All the organizations, the healthcare organizations combined, have about a budget combined of about $800 million. So that we are, for the first time, though, reaching out to a broader sector that is outside of healthcare, because we recognize that what you do affects healthcare a great deal.
Thank you.
Okay.
I'll key back in. Thanks.
Thank you, Councillor Gazzola. Next is Councillor Johnston.
Yes, thank you, Chair Davey, and thank you, Dr. Lee, for being here today. I'm not surprised that you are here and heading this up. You were tooting the horn of your wife earlier, which is amazing. But you are a pioneer yourself in terms of getting family health care and the family health care team concept and model set up in this community. So not surprised to see you working on this initiative, which when I saw that this was on the agenda today, I was very excited to see, and very, very happy to support. It's exciting, the work that you're looking to do, and I know that you kind of stepped in to fill a bit of a gap in terms of what the provincial mandate was whenever they made some significant changes to how public health is delivered in our community. So again, really excited to see this. My question was, and as you know, and you alluded to before, that COVID rates among people that live in have lower income, in multi-generational households, a lot centered in the downtown, et cetera, have some special needs right now. And we know that because we represent people that are certainly in those circumstances. So how can you see a partnership with working with the cities? How can that help kind of directly get healthcare to those in the highest needs right now?
Yeah, thank you, Councillor, for that question. I think you're quite right. Again, this is where strategic partners like the municipalities can be really helpful, because from a public health perspective, you're quite right. Those who are in congregated settings, those who are in more crowded spaces have more vulnerabilities. We know there are differences in neighborhoods. And so both with testing, also trying to isolate, such as having alternative accommodations, reaching out to our Indigenous colleagues. Those would be excellent examples of where I think there is a lot of this work being done together and needs to be done even further. I point again to the Inner City Health Alliance, where a lot of these folks are identified. And I think, you know, we can see more coming up. You know, Chris Steingart is a colleague who has been doing the Sanguine mobile bus that actually goes around, as you might know, to do testing and and trying to do that type of outreach specifically to neighborhoods, perhaps, and having, you know, people, you know, who work in that space, municipalities, help us with, you know, where are good places to set up or to do these types of outreach initiatives through the pandemic and beyond. You know, I think the pandemic just highlights to us what things can be. I think there are many examples of where we can have better targeted work for the populations and those who are most vulnerable. And at the end of the day, actually cost us in one way or another. In fact, if we don't take care of it, it costs us even more, you know, from our experience in healthcare.
Yeah, absolutely. And I appreciate whenever it's societal costs, it's personal people's lives, and truly it is our community costs. So again, I'm really excited to support this. So thanks again.
Thank you, Mayor Verbenovich.
Thanks, Chair Davey, and thanks, Dr. Lee, for coming and joining us today. And for those members of council who aren't aware, Dr. Lee's really been at the forefront and a leader in terms of innovative patient-centered healthcare here in our community, and has been a partner with many of the things we've done over the years, including the School of Medicine and the Family Health Center that's operating out of there, and the work that his wife does, and all of that stuff has all come together, and hence he's become the Grand Poobah chair, president, whatever you want to call him, of this steering committee going forward. Going back to Councillor Gazzola's question or comment, or in terms of what's happened, essentially the 14 LHINs across the province and a bunch of other health agencies became Ontario Health. And then Ontario Health got divided into these 5 regions, of which we're Ontario Health West. Bruce Lochner, who's now the regional CAO, was the interim CAO of that organization. And each of those Ontario Health regions in total have like 30 to 50 Ontario Health teams. And as Dr. Lee said, really their focus is to break down the silos and the barriers between these service delivery mechanisms, and to start having us all working and collaborating together and taking things from the work that we do in terms of recreation activities, seniors programming, and so on, and take it all the way through to, I guess, palliative care at the opposite end of the continuum. It's been really exciting. I mean, Lori-Ann's really represented the city at the meetings. Dan and I have been at a couple of them when they've asked the chairs and CAOs of the various partners to come to the table. But it's been great to see the amount of collaboration and partnership amongst everyone to really try to take healthcare in our area to the next level. For us directly, I mean, our relationship with the LHIN in the past has been in terms of our seniors programming at Rockway and at the Downtown Community Center in terms of the food programs and so on. But now there's really going to be an opportunity to be part of that directional body that KW4 is really meant to be in terms of the collaboration that we're looking for. So I'm glad that Councillor Barsh has moved it. I'm certainly prepared to support it, and I really want to thank. I know, you know, the last 9 months have been challenging for everyone in the healthcare profession, but to see the dedication of these healthcare leaders carve time out literally on the sides of their desks on top of everything else that's been going on during the pandemic to make sure that we continue to move forward has really been remarkable. And I just want to say thank you, and hope that we support this going forward.
Thank you, Mara. I would also just add to what you're saying. What we're asking of the strategic partners isn't actually dollars going to healthcare, because that isn't the purvey of that. That's the purvey of the family health teams and the hospitals and all the various agencies. It is really to help engage the community, and to engage the community with the programs that you have that cross into the healthcare sector, so that we can again have a better understanding that what you do and what we do, and if we can do it all together, it will be much more efficient, and it'll actually make more sense to people. And so that's really, again, why so many people, I've been very heartened by many, not just healthcare workers, people in this region who have been stepping forward to try and work shoulder to shoulder to help the people of this region.
Thank you. Councillor Singh.
Yeah, thank you, Mr. Chair. And Dr. Lee, I think without question, especially during the last year or so, it's quite evident that more investment into healthcare or better organization of our various healthcare teams is necessary. Now, KW4, will it provide a aspect of advocacy as well? I know it's not necessarily in the realm of providing healthcare, but outside of that, it's a collection of data and working with the various teams. And being, the way I see it, is more of a liaison. But will it also be an advocacy body for our region or our local area to ensure that we're getting the necessary continued investments in healthcare from the province?
I would say, in a word, yes. I do think that one of the problems before this is that if somebody were looking at our area, who speaks for healthcare for our area, there would not have been a clear answer for that previously. Maybe you would go to the hospitals, but they don't really speak for all of the healthcare of this region. So this is the first, and you could say the LHIN, but again, the LHIN wasn't really the healthcare organizations either. So for the first time, we have the opportunity to truly represent this region's healthcare, and I would say advocacy for sure is part of it. Not just advocating ourselves within the province, but also beyond the province, and also with advocating for health and wellness within our own community as well.
And is that part of ensuring that there's a better collaboration or link between the family healthcare teams and the hospitals as well, so that there's more communication happening or flowing in between?
Absolutely. Digital care, digital communication, and not just primary care and the hospitals, but also across sectors, community care, palliative care, mental health and addictions, every aspect of care. These all have to be tied together seamlessly.
Okay. And as a obviously as a member, and City of Kitchener would be paying a fee to be as a member, what type of direct assistance would our staff be receiving from KW4, or data or information that can better help do the work? And in the report, it talks about, while our mandate and role in healthcare sector space is minimal, our resource investment support creation of safe and thriving neighborhoods, resident connectedness and belonging, and the provision of recreational, leisure, and social opportunities. Where's that space for KW4 to help broaden what we do or better what we do in that space?
Right. So we do have many working groups. So working groups working on issues like the pandemic, like the homeless and precariously housed, refugees, of which there are many folks in Kitchener, frail elderly, digital health, data, evaluation, and it would be to invite people from the municipalities who have expertise and perhaps passion and reason to be in these types of working groups, to actually give their valuable input as to how we shape programs within this region.
So what I'm hearing is assurance that we'll get plenty for a $50,000 annual fee.
I don't think that'll be a problem.
Excellent. Thank you, Dr. Lee.
Thank you, Councillor Michaud.
Just if I could just go back to ask about the shelter services, what types of support do you collaborate with on this? I wouldn't mind a little more information on that.
So, so the question is, how does the Ontario Health Team relate to shelter health? I guess,
Yeah,
or-
you do offer support. You mentioned House of Friendship and the other organizations in this region. Do you support them directly, or how does that support work?
Well, they are us, right? So the House of Friendship, Ray of Hope, the Working Center, Sanctuary Health, Downtown Kitchener CHC, Center for Family Medicine, all those organizations are part of the Ontario Health Team. So their work is our work. And so it's orientating their work to be collaborative and working together. So there's tables where all those organizations sit as a inner city health alliance, but it also brings in the hospitals, so we can have hospital specialists tied into that work, or it's bringing in other mental health and social agencies, so they can bring in, other counselors into it that may not be pre-existing. So it enhances the current works that's been done over the last couple of years with the Inner City Health Alliance, from my perspective. As an example for, our refugee health population, translation services have been, I'll just say it, abysmal in our region. And it's something which has been getting better. And that's through advocacy, and that's through working together, so that, people don't bounce around from agency to agency and nobody knows what's going on, right?
Absolutely, yeah. Is it membership based then for these organizations, or?
It is membership based. We have ensured that every major organization in town is part of it. It's very inclusive. That's why there's more than 30 organizations, such as the ones that I mentioned.
Okay, thanks.
Thank you, Councillor Chapman.
Yeah, thank you, Dr. Lee, for coming in and promoting this. I have a question. So under the LHINs, am I correct in thinking that grant money was available for organizations to apply and run programs?
Okay, sure.
Does the same thing come out of the Ontario Health Teams?
I wouldn't see it that way, but I would say it this way. The province, for better or worse, feels this is the way forward. In fact, I suppose from my perspective, this is not unique to Ontario. Around the world, many jurisdictions just see the need to reduce silos, break down barriers, and get better value for money at the end of the day with better communication. And so what this will mean, though, is that all new future funding for healthcare for this region probably is going to be flowed through this Ontario Health Team. So if there's some provincial initiative, say they want to focus a lot more on mental health and addictions, as a specific example, they'll say, okay, KW4, OHT, here's a bag of money, and you go forth and figure out how to deliver this in your region. That's probably the future of a lot of healthcare funding. And that's where having municipal strategic partners would be very valuable, with new programs orientating how maybe your recreation programs or things like that could be informed by these initiatives coming out.
And do you feel that the recreational programs and the programs that the city currently runs do not suffice?
Oh, I think it's great. It's just not tied together, right? So that, when just the opportunity to, if you're trying to target certain at-risk populations, you have better advertising, promotion, tying it together so it makes sense to people. If people have addictions and, mental health issues, if you could at the same time tell them about various social connections that they might have, or offerings that you might have at the city, that would be fantastic from my point of view.
Right.
And they keep them out of the hospital and out of my office.
I mean, the other concern I have, not, I don't know if it's a question. So when we talk about, when you sort of laid out the different things that a municipality could do, you talk about testing, you talk about alternative accommodations, Indigenous community outreach places, etc.
That's not for the municipality by itself. I'm talking with the OHT, all of us together.
Okay, okay.
Yeah.
And is the long-term goal to get rid of public health? Because really they're the go-to people in this.
No way.
No.
Absolutely no way. Public health is one of the sectors of that, you know, it'd be like getting rid of the hospitals or getting rid of primary care. No, absolutely, you know, the public health, this is enhancing public health. You know, Shu Li Wong and Julie Emily and Ryan Van Meer, they speak to us all. They're part of us. The public health is part of the Ontario Health Team.
Okay.
So people should understand they really appreciate the OHC structure because they can communicate to other doctors, the hospitals, House of Friendship, this place, that place, so much better through the structure than they ever could before. A lot of the testing and so on, driven through public health, has been enhanced by having this structure and better communication and collaboration.
Okay. So, and I'm not really questioning the value of collaborative work and you know, or the work that's being done certainly by Sanguine and public health. I think it's amazing. I take my hat off to all of you. I want, my last question will be, so if the city were to take an affiliate membership rather than a, what are you requesting that we do, a strategic membership?
Strategic.
What would the difference be as far as you're concerned?
There would be not as much involvement. We would not have decision-making ability. It would be lesser engagement. It would be just a different level of engagement. I think that would be fair to say.
Can you give us some examples of who some of the affiliate members are?
I'm trying to think. There are very few. I think one of them would be Lutherwood, maybe an affiliate because of financial reasons right at the moment. I think also another might be a children's mental health institution because the focus is not currently directly involved with our priority populations, but those would be examples of affiliate members who want to kind of be involved, but at the sideline, so to speak.
Okay, thank you.
Thank you. Before we go to round two, just a couple of quick questions, if I could. You touched upon it a bit with Mayor Rabinovich, but could you explain again, you touched upon the purview, the jurisdictional discussion about municipalities funding this. Traditionally, people typically look to primarily the province and in some respects the upper tier. Why is this applicable specifically to Kitchener?
Right, because, well, I would give a declared bias. I think we have the opportunity to have a special Ontario Health Team in this area, which I would admit is more ambitious than many of our sister regions, because we subscribe to the notion that the social determinants of health and what the municipalities do makes a difference to the health of the people that we serve. That when you have your recreation programs, when you support community programs for this and that, there's a direct tie-in to how people do. When you have your bike paths or your whatever you're doing, you know, does that have a direct impact and indirect impact on our bottom lines as far as hospitals and family practices and social agencies? We would submit to you absolutely yes, and literature would show so. And you know, I don't think it's a big stretch to think everything is tied together.
Is apologies if I missed it, but what's the regional government's connection to this?
The region of Waterloo is also going to be a strategic partner as well, and the city of Waterloo as well.
Okay, thank you. Second round, Councillor Gazzola.
He's on mute.
Yeah, a number of questions have been answered. I wondered about the region of Waterloo. So they are a strategic partner.
Yes, I'll be speaking to Bruce about that very soon.
And they'll be paying their $25,000-$50,000. What about Cambridge and North Dumfries? Where are they?
Cambridge and North Dumfries are a separate Ontario Health team, so that there are two in the region, KW4 and Cambridge North Dumfries Ontario Health teams.
Okay. How much do the partner members of this organization pay?
There's a formula that's outlined in the CDMA, which it depends on the size of the organization and their yearly budget. So on the high end, Granville Hospital, with its about $400 million budget, pays much more than a small organization whose budget may be $1 million. So it is quite varied depending on which organization of which you speak.
Okay, thank you. I'm starting to understand a little more of this. I didn't see it in the report, but we have the Ministry of Health, and we used to have LHINs, and now we have how many Ontario Health? We're Ontario Health West. Are there four? Did I say five? Five things.
There are five. Yeah.
Okay, and so, and we're part of Ontario West with their 30 to 50 teams like ours. So we're really just a lobby group. Is that right?
I don't think so. I don't think there are 50 actually on Ontario West, but there might be. I'm actually not sure, 25 or 30. Anyway, regardless, no, they're really they're collaboratives who are trying to work together more efficiently for people's health. So hospital work, doctors' offices work, social agencies work, those are all captured in this. So it is care delivery to people, as well as, again, trying to do things more efficiently, trying to do it for better value, but lower costs at the end of the day through efficiencies and communication.
Yeah, I appreciate where you're going, and I don't have any issues with it. I'm just trying to understand it. I look at it, and before we had the Ministry of Health, and we had LHINs, and then we had all of everything below it. Now I see another line in there. Is that a duplication? Is that so it's a totally? Are we duplicating on what other things that are being done?
Well, I would submit to you, with the taking away of the LHINs, we actually have less bureaucracy and less lines than we've ever had before. Yeah, but I can appreciate the fact, Councillor, though it's very confusing. There's a lot of changes, and it is confusing. I would say, though, I've been a physician in town for 32 years. I did see things like the health science campus being built and so on. I would say this is the biggest change and probably the most exciting change in healthcare that I've ever experienced myself as a physician in Ontario in 32 years.
Thank you. If I can just make a quick comment now,
Please.
If I can just make a quick comment. I appreciate, Dr. Lee, I'm familiar with you and your family and what you've done, and how fortunate we are in this community to have you. I get concerned when when I see what's happening, I don't have much faith in the Ministry of Health. It seems to me about 15 years ago, they were going to bring out a health card that told everything about me that could be shared and was really up to date. And I'm not sure where that is. I don't have one of those in my wallet. I know I had to go and see a special eye doctor last week, and I had to carry a whole bag full of pills that I take to show them. So I'm a little skeptical of it. I can see where this is going, and I hope it works. I hope it works better than where we've been. I just, unfortunately, and it's unfortunate that I'm sort of calling it the flavor of the month. I hope it isn't. I hope it's a real improvement over where we are now. So thank you very much.
Maybe I'll just say, I think your skepticism is with good reason. I think there's a lot of physicians who have been skeptical about this all the way along. It's show me show me the proof. I would say that there are a lot of physicians for the first time are extremely excited and hopeful, which actually makes me very heartened. And this pandemic has shown to me that old dogs can change and we can work together better.
Thank you. Mayor Verbenovich and Councillor.
Thank you.
Sorry, apologies, Councillor Gazzola. Mayor Verbenovich, Councillor Singh, do you have questions or comments?
A brief comment.
Councillor Singh, comment or question?
Comment, that's all.
Comment. Okay, Mayor Verbenovich, go ahead. If you have a comment, please cue in.
Councillor Gazzola, you're 100% right. This is complicated, not easy. I actually just came across an old deck that was done for the Crime Prevention Council as they were in 2019, as they were starting to think about these OH teams, and it actually sort of describes how all this works. So I'll flip it to council just so you have it, because I think it may be helpful, because it is very confusing as you go from one to the other. But I think in theory, right, and I'm not defending the decision of the government, it's what, as Dr. Lee said, it's what we all have. But in theory, the 5 regions are to take the bureaucracy side of the Lynn House, and the teams are to take the collaboration side of healthcare and try to get people working better together. That's probably a way to describe how the two have been divided up.
Thank you, Councillor Singh.
Yeah, thank you, Mr. Chair. I'll also be very brief. I think it's not enough for us to complain about the system or of our healthcare of things that don't work. And I agree with the concern that Councillor Gazzola has laid out. It's better for us to be mindful that any new investment needs to ensure that we are getting the positive returns back. But I think this is exactly what this organization will be able to do. This is an investment into our general health well-being of this community, and I think this is a first step. But I think a lot of positivity will come out of this, and of course, led by community leaders like Dr. Lee himself, I have even more faith. So looking forward to supporting.
Thank you, Councillor Michaud.
Thank you. As I'm listening to all of this, I just Googled KW4 and came across an article from St. Mary's Hospital. And I have to say, your list of steering committee organizations is long and impressive. This looks like a really great collaboration that really can only enhance our healthcare in this community. So I'm really happy to support this.
Thanks. There are no other comments. I'll be supporting this as well, but I want to be clear, there's a level of pragmatism in the support, and that is I'm still not 100% clear that this should be funded, frankly, through municipal property taxes, and nor do I think it's primarily in our jurisdiction. But the work is very important. It needs to be done, and if we're not connected to it, we need, it's just going to harm our community. So that's something I'm always sensitive to, because it seems like our realm of jurisdiction is ever growing and expanding, and I'm worried we're going to come to a breaking point one day, hopefully not for a long time, but the work is important. I will support it. Thank you, Dr. Lee, for coming in. So it's been moved by Councillor Marsh. Those in favor? And opposed? Oh, didn't see any opposed. Very good. Okay, thank you. The next item is, where are we here? Oh, the proposed amendments to the changes to the municipal code, and Mr. Bunn.
Thank you, Chair Davey. Today I'm here to present to the committee on the recommendations arising out of a recent comprehensive review staff undertook of the city's procedural bylaw. I'm just going to bounce between screens here so I can display. There we go. First and foremost, this review is not about addressing meeting efficiencies, as was the case in 2014 and 2015. Most importantly, no changes were made to the procedural bylaw that are practices that are working well for members of council and standing committees. In general, it's considered good governance to review your procedural bylaw every couple of years, which was the catalyst for this review. The purpose of this review was to align with recent legislative changes to the Municipal Act, primarily with Bill 197, the COVID-19 Economic Recovery Act of 2020.
Excuse me, Mr. Bunn.
Yeah.
I can hardly hear you. I don't know about anybody else, but I was having trouble hearing.
Oh no.
You could maybe
I can
sit
speak a little
close to your
louder.
mic. Sorry.
No worries. I can yell.
Okay.
It's all good. The second was to address ambiguous language that has been leading to past confusion, whether it's in a meeting or with staff prior to meetings. The third was to remove redundancies and address inconsistencies in the existing procedural bylaw. And the fourth was to codify current practices of City Council and standing committee meetings. And finally, the fifth was to achieve consistency with current municipal best practices from other municipalities and the Ontario Ombudsman. The vast majority of the recommendations in the report will provide clarity to ambiguous language and to align with current municipal best practices and with the practices of our standing committee and council meetings. To augment this review, staff engaged in one-on-one discussions with members of council, specifically on the larger, more substantive changes being proposed. The outcome of these conversations aligns with and helped form the recommendations within this report. On July 21st, 2020, the Ontario government passed Bill 197, which amended the Municipal Act to allow for electronic participation during closed meetings and for members to participate in open meetings and to count towards quorum. Bill 197 also amended the Municipal Act to allow councils to decide if they wish to pursue proxy voting in accordance with the process to be established by the city clerk. As council is well aware, electronic meetings are not completely new to the city of Kitchener. In March of 2020, we were the first municipality within the region to implement electronic meetings in response to COVID-19. In August 2020, council took an additional step by approving the temporary use of electronic meeting participation in open and closed meetings and allowed members participating electronically to count towards quorum. The recommendations outlined in that report stipulated that the provisions would be temporary for electronic meetings and they'd be in place until the review of the procedural bylaw that we're looking at today was completed and brought forward to council for consideration. The changes outlined today are more permanent changes to the bylaw and would mostly affect post-COVID council meetings in terms of electronic meeting and proxy voting. So the recommendation before council today is to approve the proposed amendments outlined in the staff report and Appendix 1. Putting a more finer point on those recommendations, specifically for the new tools of electronic meeting and proxy voting, staff are recommending that council approve the use of electronic meeting participation post-pandemic, that electronic meeting participation be implemented for closed meetings initially, and that staff be directed to research and report back to council on the costs and timelines associated with enabling the council chambers to facilitate hybrid meetings. And that would be meetings that are both in person and with members participating electronically. And finally, for the electronic meeting component, that electronic participants count towards quorum and be permitted to vote during those meetings. And finally, the last recommendation is that council does not adopt proxy voting at this time. So the next steps involved in finalizing a draft bylaw based on the direction council provides today will be to essentially walk through the steps that are on the screen here. So today council will consider those recommendations, and on January 11th, council would ratify any direction coming out of today. And on January 25th, the procedural bylaw would appear on the City Council agenda for consideration. All of this is in accordance with the prescribed process that is already in the procedural bylaw. That's the end of my presentation. I'd be happy to take any questions at this time.
Thank you for the presentation, Mr. Bunn. Councillor Johnson.
Yes, thank you, Chair Davey. And my question is, I'm reading here that the post-pandemic electronic meeting participation is recommended. Office meetings only until technical improvements can be made to the council chamber. I'm wondering when we are looking to do that. I read further that it would be up to $1 million, but I a time period for that.
Sure. So through you, Chair, the $1 million quote is to do a full retrofit of the entire council chamber. So that's looking at other municipalities. We've undertaken a bit of a quick review with a consultant to look at our council chambers as it is, to see what it would cost to retrofit just the basics to make it work so that we could hear and see folks participating electronically. And the cost for that high level, we're looking at between 10 and 15,000. So the recommendation is that staff would go back to that consultant to get more details and the detailed design on what that would look like, as well as a timeline to implement, and then report back to council. And to be quite honest, I would suspect that would be probably a month or two's time before we come back to council once we get that review with the consultant complete.
Okay, and a question as well around some of our committee meetings. And one thing that I've noticed with some of the committee meetings now that we are doing them on Zoom is that I feel that they have been a nicer atmosphere sometimes than ones that are held in some of our bigger rooms where we're really far apart from people, and that I feel like some of them we've had better conversations. It's been more cohesive. I think with having some of those committee meetings in a different atmosphere than necessarily at City Hall. So I'm wondering about plans for kind of that continuation. I mean, as I read in here, it's something that's being considered, but I think that as we go post-pandemic, we're changing. With this last 9 months has forced our society to change, and I think that there will be a lot of people that will want us to be looking at this as an alternative in the future. So maybe we can talk about the plans for committee meetings.
Yeah, so for committee meetings, they're a little bit different in the sense of we have to live stream and make it accessible to the public. So right now, of course, with COVID, we're not going forward with live streaming all of our committee meetings, but making them accessible to the public by inviting any member who would like to attend electronically through Zoom or Teams or whatever the case is. Long term, it is something that we have been thinking about, particularly when you hear anecdotally some of the feedback, and I think you're alluding to that people are feeling more comfortable attending electronically. And I know certainly in speaking to clerks in the region and outside of the region, they're also hearing the same sort of feedback. So I believe once we enable our council chambers to allow that hybrid, I think it'd be council's direction, but it would be very feasible to have that long-standing offer to the public to say, if you'd like to attend electronically, if you're more comfortable, certainly that's an accessible option. I think the other key component there, and again, something that you've sort of alluded to here, is that electronic meetings do make it more accessible for families that are, a single parent at home who has children and unable to come to council chambers at 7 p.m. for a public meeting, for instance. So we are seeing the participation increase through members of the public in that sense. And I would think, and I don't want to speak for the public or speak for council, but I think we would see that expectation coming that, during the pandemic, you're able to make this work. How can you make it work post-pandemic? And I think that's what we're trying to achieve here with the direction today.
So aren't we making that decision today about for the long term? Well, yeah. So I do think that we personally need to look at that hybrid model then, so that we give, we want participation. So I think the more ways we enable people to be able to participate is really important. Thanks.
Thank you, Councillor Marsh.
Thank you. Yeah, so I'll just piggyback on Councillor Johnston's questions a little bit. I'm surprised as well to see that we're not being recommended to just go right ahead and direct staff to look into those options for retrofitting in the smaller way, not the overhaul. Because even pre-pandemic, there were some issues with not feedback, but echoing a lot, depending on how many mics were on. So it was already an aging system, right?
Yeah, through you, Chair, that is correct. It is an aging system that certainly is showing its age in certain areas. The feedback, I believe at this point, we've worked with a consultant and we were able to address that right before the pandemic really hit. We stopped the in-person meetings. So it's unfortunate that we weren't able to test a little bit more, but certainly to go any further with enhancing the audio visual or the sound system is going to require a more sizable investment on the capital end.
Okay,
But,
great.
Yeah.
Now on page 2-4, one of the parts that you that is explained in the report is saying that when one-on-one members, one-on-one meetings with members of council identified that that we should only limit how or when we participate electronically to very few circumstances, and that travel circumstances, both vacation and business travel, were identified as invalid extenuating circumstances. I don't remember being polled by that, but it's been a while. So, I would never have suggested that. Like, for example, if our mayor, who's representing, international mayors, is traveling, doing that work, and I don't believe that it should stop him from participating in our council meeting remotely if he's able to, that type of thing. So are we voting on that, on your recommendation here today? Can you clarify?
Yeah, so through you, Chair, there is really no recommendation on the limitations of it. And this is something that staff did have a pretty robust conversation about because the conversation with members of council was unique in itself in different ways and how it organically flew. So I'm not sure of your particular conversation that you had with Sarah. I believe Sarah was probably doing yours. But I know this came up in a lot of other conversations in terms of should there be restrictions, et cetera. At a staff level, we were looking at that, and really, these are your meetings. These are council meetings. This is council's bylaw. So ultimately, it's council's direction and I would say prerogative to decide what those limitations would look like and what would be an acceptable use, or if there's fears of someone abusing that privilege, how that would look. And that's sort of why we didn't go that route in the report or in our recommendations of saying, these are the concrete reasons why you should not be using it or why you should.
Okay,
because we do believe it's up to you.
And so if it's up to us, and normally our way of conducting business here at the city is that staff comes forward with a report and council deliberates and decides. So in this case, are you not going to create a report that we then discuss and decide on the rules, or is that something that we need to generate?
So through your Chair, with this, in this instance, this is a tough one, Councillor Marsh, because the procedural bylaw doesn't prescribe all the rules and regulations, even for attending a meeting and not. So, my mind tends to, it's going towards other parts of the procedural bylaw that speak to missing meetings, for instance. So if a council member misses 3, 5, all procedural bylaws are different meetings. What is council going to do about that without some sort of valid excuse? And, I think it's fair to say, and I've looked at municipalities across Ontario, and it's kind of a hobby of mine. I like to look at procedural bylaws, and what I see happening in the municipalities is it's not quite often if someone had a medical reason, for instance, that they, if they're missing 6, 7 meetings with a pretty valid excuse, that the colleagues on council would accept that, right? And I think this electronic meeting participation would open the doors to allowing that member to attend. And I think, just based on how you see other municipalities act, I don't know if it needs to be codified in the sense of written rules, or if it's just, if it becomes an issue, it would be a member of council's prerogative to raise it to say, hey, another member of council hasn't attended X meetings. This is something we should consider. But at this point, I wouldn't go as far as putting in those restrictions right now.
Okay. So I would suggest that we direct staff, and if you need a motion for it, I would be happy to put it forward, that we direct you to go right ahead and get some quotes on how to retrofit in the least costly way so that we can have a hybrid model when we return to council chambers someday.
Okay, just before we move on, just a point of clarification then, Mr. Bunn. So my reading, although it's not explicit that isn't explicit in the recommendation, it does indicate that that work's going to be done throughout the report. So that wouldn't require a change to the recommendation, Councillor Marsh's comments, or?
Through you, Chair, if you'd like us to report back with that, I mean, given the value dollar,
Oh, I see.
we could move forward. But it's up to council to decide if you want us to report back or not.
Okay. Okay. Sorry. Yeah, I was just looking at 2-5, and it says that part of the recommendation was that you engage the consultant, but I assume that meant reporting back. So I'd be looking, Mr. Chapman.
Through the chair, I saw the same reference as you, Chair Davey. It says in the first bullet, Jeff, at the bottom of 2-5, would investigate enabling hybrid meetings, report back to council on total costs and a proposed timeline for implementation if approved. So I believe that's what Councillor Marsh has requested. So can you confirm that that is your intention to do that work? And if so, what the timeline is?
Yeah. So through you, Chair, we will be doing that work over the next 2 months. And I suspect we'll be back at council before the end of January, early February at the latest.
Very good. Thank you. We'll continue through the list here. Next is Councillor, sorry, I lost track of who's in order here. I think Mayor Verbanich was next.
Thanks, Chair Davey, and thanks to staff for this. It's you have to have a real passion for this work and for this detail to deal with things like procedural bylaws, but they also are incredibly important for the operation of any democratic governance body. I certainly am supportive of looking at the technology pieces and pursuing that. I will say, and I do know that the question got at least asked, as I recall in my interview, around council meetings and absences and so on. I will be frank, I think that in my mind, the jury's still sort of out on that. We just got this, the ability to do this recently because of the pandemic from the provincial government. I'm not sure how in the long run I feel about it, because I think there's a role for us to be back in the chamber when the time comes. And so as one who's been involved in FCM and things, yeah, I mean, I didn't like missing it, but I understood that was sort of one of the balancing pieces. And so I do think we need to think about it. But on the other hand, I also think about how we did lobby to change the rules successfully. For example, when somebody has a newborn, as Councillor Galloway-Seelock did. And you'll recall in the past, the rules were, had she, for example, been hospitalized prior to the birth of any of her children, council would have had to okay an absence of more than 3 months in order to accommodate that, which in my mind was silly. I mean, nobody should have to deal with that and hope that the council, whatever council it is, by their good graces is going to allow someone to manage that. And so the provincial legislation was changed, and I think that was a good thing. We certainly found ways of between using the caucus room and so on, managing all that. And so I think there's circumstances where the dual situation could work well. So I think that should be part of a broader conversation in terms of what it might look like in the long run, and sort of what those circumstances may or may not be, in terms of what's okay and what's not. I recall, for example, in another municipality that shall remain nameless, there was a retired elected official who spent their 3 months in the winter down in Florida and flew, or 3 or 4 months, and then flew back just to not kick in whatever their role was in their council, where they got into trouble. I wouldn't want, for example, to be in a world where someone can be absent for 4 months, or, on vacation for basically. I don't think that's, the system's not meant to work that way. So I think we just need to think long and hard before we go down some of those potential paths in the future.
Thank you, Councillor Schneider.
Okay. Oops. Thank you, Chair Davey. A question for Mr. Bunn. When we're talking about electronic participation, are we talking like video and audio or just audio? What's the consideration there?
Through you, Chair Davey, it's actually any. The municipal act doesn't specify if it has to just be audio or visual. Right now, for instance, if a member of council's audio doesn't work, we would certainly try to get it to work in the best way we can. But if their video doesn't, we have members of council join without video now, and I think we just accommodate based on the circumstances. Ideally, and I think this council shows it right now, we're looking to see people's faces, and I think that adds a connection, but there's no rules in place to say you have to have a video included.
Yeah, I think that, seeing the faces is great to have, but if we can just get the delegation to speak. I thought today with the downtown cycling grid, there was great participation because it was electronic and people could spend a little time out of their day and do their part. I do hope that we can go down and find ways for councillor participation electronically. I mean, there's been situations like maternity, and Councillor Michaud had an injury last year, which, she could participate electronically. I think that would have been great. So I think most of us here in council will want to participate no matter what situation we're in. And if we can do it electronically, great. But yeah, the potential for abuse might be there too. So if we can get that right balance, that'd be great. Thank you.
Thank you, Councillor Johnson.
Yes, thank you. And just piggybacking on Mayor Verbanovic's comments, I'm wondering then, I am happy to support this. I wonder though if we can take out the paragraph on 2-4 with regards to our conversations around what would constitute a reason to be able to attend a meeting electronically if need be. I think there is a big difference between vacation travel and business travel. So if you can show that you are legitimately on business travel, and again, it would need to fit into certain parameters about how many times that happens, etc. I know I sometimes have a meeting once a year that coincides with a council meeting that I think there are certain circumstances that need to get looked at there. So I would be happy to support this if we kind of can now table a conversation where we're all on the same page. Maybe we all get the same form to fill out, so we know that we all got asked the same questions, so we can come back and know then that we all came to an agreement in particular, not just one-on-one conversations as well, so that we know it was well discussed. And maybe that's an agenda item at a council meeting. I'm not sure, but it's hard to deal with that piece today until we maybe have more information about what the system is that you're going to bring back. So maybe we can agree to go ahead with the system and then table that particular conversation. Is that doable to take that piece out for today?
I would look to Mr. Bunn to comment, sorry, but I would suggest that because the portion that you referenced, Councillor Johnson, I agree with you, but because it's not in the recommendation, I think staff will take that under advisement. My comments would be similar, but Mr. Bunn?
Yeah, through you, Chair Davey. I would just point council to the line right underneath the travel circumstances. And basically what we're saying here is ultimately it's the discretion of council to deal with that, how they choose or how you choose, particularly as it relates to what would be a valid reason why not. So there really is no recommendation in the report itself saying there should be limits or there shouldn't be limits. We're just saying we talked about it. Council raised some concerns through those conversations, but there was no definitive, this is the way we need to go. And that's why we chose to to almost be sort of silent on that point at this point.
Okay, I'm not seeing anyone else in the queue. I believe Councillor Marsh moved it. I don't see her camera on here, but I'm going to, Councillor Marsh, did you move this? Yes?
I didn't, but I can.
Oh, okay. Okay, if you don't mind, thank you. It's effectively encompassing what you suggested. Yeah, I'll be supporting this as well. And it's not lost on me, Councillor Johnson's comments, and also echoed some by Mayor Urbanovich, that whenever we're writing policy these days, as we've seen throughout the north and south of the border, unfortunately, you have to write policies in a way with a lens that how can they be abused, right? So I think staff's taken that to heart when they look at this and come back. I'm also happy to see that $1 million figure on the retrofit is, I'm going to assume that's the Tupac hologram version of council meetings. So I'm glad to see that's much more in line. But as moved, Councillor Marsh, those in favor? And that carries unanimously. Thank you. We'll move on to the final version of the Digital Kitchener Innovation Lab update. Mr. Murray, when you're ready.
Hello, good afternoon, Chair Davey and members of committee. I'm joined today by Ms. Courtney Zinn. Ms. Zinn took over as the lab director at Digital Kitchener Innovation Lab in mid-2019. Ms. Zinn jumped into the lab operations, ensuring the continuity of the existing work underway and also bringing a new level of city staff engagement with the lab, leveraging strong connections with staff and quickly establishing new connections within Communitech and the tech community. So I want to thank Ms. Zinn for willingness to jump in halfway through the pilot project and for all her extraordinary work to ensure the lab brought great value to the organization. Ms. Zinn will now present an update on the lab achievements and also how we've been able to operationalize lab services as part of the Technology and Innovation Services Division. Ms. Zinn.
Thank you. So I'm happy to be here to share this update with you on how the Digital Kitchener Innovation Lab has progressed throughout the pilot period and what our plans are moving forward. Next slide, please. So just to recap the 3-year Innovation Lab pilot, it launched just over 3 years ago with the grand opening happening in November 2017. The first 2 years were primarily focused on supporting and promoting Digital Kitchener, both internally and externally, and exploring the use of IoT or Internet of Things technologies for data collection and possibilities around visualizing all of the incoming data that would come with that. In the final year of the pilot, we shifted focus a little bit to take action around emerging technologies, collaborating with stakeholders, and aligning our projects to the strategic priorities, such as corporate sustainability and transportation. This allowed us to engage more with staff and their existing work and explore how we could apply new approaches to that work. Next slide, please. So just looking at some of the achievements of the lab throughout the pilot period. As mentioned before, early on, we focused a lot on hardware prototyping and data pipelines. We built our own Internet of Things devices and sensors, including CO2, asset tracking, and we worked on creating pathways of real-time data visualization and understanding different connectivity options. We took a look at augmented reality, working with our planning team to build an augmented reality app we called Augmented Municipality for visualizing 3D models. We took a look at augmented imagery and wayfinding and how that would augmented reality could improve experience. We dabbled in machine learning and artificial intelligence, and that's something we'll explore further, but using computer vision and edge processing for people in dog counting, applying machine learning to make recreation program recommendations and water main break forecasting, and currently looking at sentiment analysis to look at social media comments on city projects and services. More recently, we've been engaged in pandemic response work, rapidly mobilizing to help monitor the evolving state of our workforce throughout this period and supporting some of the internal groups as they move services online and meet some of the new challenges 2020 has thrown our way. And throughout all of this, we've focused a lot on engagement. We've engaged with citizens through volunteer tours and encouraging them to participate in our design sprint activities. We've worked with staff on the design sprints, as well as some build with us sessions we held with technology innovation and services to try out some lab technologies. And then with the tech and academic community through Communitech and a number of other projects, both with startups and academic institutions. Next slide, please. So I just wanted to include a few images here of some of our projects. Some of them don't translate well to just a static image, but just to give you a sense, in the top left-hand corner, that's the augmented municipality application showing 3D models. Just below that is some augmented imagery where we brought the strategic plan to life. Basically, the paper fold out, hovering over that with a mobile device would play the accompanying video, which was really neat. The bottom row highlights some of the computer vision and rapid prototyping we've done to count not only people, but also dogs. And then moving sort of counterclockwise, the middle right image is one of the interactive prototypes we developed through our latest design sprint around air quality data. And the top right-hand corner is a glimpse of part of the award-winning multimodal counting solution you heard about just a couple weeks ago. Next slide, please. So moving on from the pilot, through that period, we learned a lot about what sort of works within the organization and what doesn't. And we're focusing on where we've seen the highest value outcomes for the city moving forward. So while retaining the ultimate vision of the lab is future focus, challenging us to explore new approaches and possibilities. Next slide, please. So through this focus, we're looking at 3 key services within the lab. The first being design sprints, which I've spoken about, mentioned a couple times. So the design sprints allow us to apply design thinking and human-centric approaches to innovation in a time-boxed way, so we can quickly move ideas ahead and test them within a matter of days or weeks. We recently completed a design sprint on how we might make localized air quality information meaningful to citizens and the school community. As part of an air quality pilot program we've been collaborating on with our corporate sustainability team, Wilfrid Laurier University and Hemera, an environmental consultancy. The next is rapid prototyping. So allowing people to bring their ideas to life quite quickly and make them tangible can really help us identify and explore options and learn really quickly about what works, what doesn't, what needs more investigation. An example of this is where we've used computer vision to count people and dogs, and augmented reality to build a wayfinding application that could be used to direct people through parks or facilities. In both cases, we used rapid prototyping to start with the basics and refine our ideas and prototypes as we learned more about both the problem and the technology. Finally, technology exploration, recognizing the current pace of technology, trying out the new technologies and exploring municipal use cases helps us get ahead of the curve. So for example, we've been exploring machine learning and artificial intelligence use cases, and there's definitely more work to be done there. But we're working on building our knowledge in those areas and demonstrating the possibilities with staff. Next slide, please. To deliver on the key services, we're refining our work to build a strategic work plan that supports the city's priorities and the big challenges. We're partnering with the internal business areas to look to the future and help them prepare for what's next, and how new approaches and some of the emerging technologies we're looking at might help them to get there. Next slide, please. To get the job done, the team needs to support the work plan in both size and skill set. So we're taking the approach of a flexible and dynamic staffing plan that both retool staff expertise that already exists and boosts our capabilities within our existing capacity. There's 3 key features of this plan that will lead us to success. Firstly, the lab director role, which holds accountability for delivering on the work plan. In quieter periods, this role can also take on technology research initiatives, such as data strategy opportunities. Alongside the lab director will be a flexible co-op staff, 1 to 4 team members. The co-ops will be hired with specific skill sets that reflect the needs of the work plan, Roles could include user experience design, data scientists, software developers, and engineers. Finally, tying this all together, we want to leverage project teams where staff are engaged in the lab for a focused time box period to deliver on specific deliverables. Where we've really seen success over the last year that I've been in the lab is where we've had that strong engagement of subject matter expertise. We certainly don't know the ins and outs of all of our various business areas. So that really helps ensure project success and that it's relevant for the business areas we support. Next slide, please. So bringing this all together, the lab will continue to put innovation at the core of what we do and how we support the organization. Through the pilot, we've become recognized as a smart city, and we've built the reputation as such, and we often hear from other municipalities and organizations to learn about what we're doing. We're treating innovation as a core service within technology innovation and services, really operationalizing what we've learned throughout the pilot period. We're a collaborative partner. We are pairing existing staff expertise and strategic partnerships with innovative new approaches, boosting our capabilities within our existing capacity. And finally, our operations are strategic and future focused. We're really trying to align the lab projects to strategic priorities and the big problems we face as an organization. Next slide, please. And that sort of sums things up for me. I will open it for questions.
Thank you, Ms. Zinn, for your presentation. I do have 4 people in the queue with questions so far. I just remind members of the committee that we do have the public input session in about 10 minutes, and we'll have delegates waiting. So if you could keep your questions and comments brief at this point, I would appreciate it. And apologies, I did not have don't think I had the order. I recall Councillor Singh was first.
Yeah, thank you, Mr. Chair, and I'll try to be respectful of the timing. I wish we did have more time on this, as an update on this, as some of us have been waiting for a long time to get a review of what we had all saw a good avenue to leverage on technology to find solutions that can help save money and create efficiencies as a corporation and as a responsibility to our taxpayers. And that's where I kind of really wanted to touch base on. And again, I respect that we're short on time. So if we can answer all of that, and my question is to staff, that's okay. Perhaps we can revisit, or more questions can be asked during when this comes back during a council meeting. Oh wait, there's no direction, so it won't be coming back. I guess this is just for information, correct?
It's for information, but staff are coming back in the first quarter of 2021.
Right. And at that point, there would be additional funding. So some of the questions I asked maybe can be answered at that point as well. When we're speaking of machine learning, artificial intelligence, augmented imagery, and the IoT, again, these are all fancy words and they look really good on paper. But what I'm looking to see is where have we been able to create either proprietary tech that we see as a way of us selling that perhaps to other municipalities, because it's a solution that we found to a problem that probably exists for others as well as us. And on top of it, where have we been able to utilize in these segment of criteria and lessen our cost? I know it says that we've used artificial intelligence to better forecast water main breaks. Would staff be at a later time, perhaps even be able to outline the potential savings that we've been able to produce through this new technology, or even the creation of data or artificial intelligence programming that we've been able to compile?
So you've got 2 questions there. So I'll the first one, in terms of the ability to sell anything that we've created. One thing that's become, and I cautioned when we started this that it would be difficult to get to a point where we could spin off the technology that we create. Largely, and I think what I've started to realize is the venture capital that goes into a lot of these companies to actually get to the point where there's a product that they can sell is significant. So we've always kept our eyes open for anything that we'd be able to partner with somebody and be able to license, similar in a way we did years ago with our OnPoint enterprise mapping system. The city actually developed the concept of that, but there hasn't really been a product that we would be in a position to turn and sell to specifically out and market. And I'm not sure with the funding that we're running on a municipal budget, I'm not seeing a whole lot of opportunities as we go forward with that. In terms of the second question was really around the efficiencies. I think the biggest thing that we've been able to do is get data on what we're where we're making investments. So a good example is the multimodal counting, which was put up on Belmont when the bike lanes were originally being planned for there, so that we actually had some data that would support the expenditures that were happening. A lot of this is about providing data for being able to answer questions. So it may not necessarily be a technology that we end up being able to, we can certainly share our experiences with other municipalities. There's products that we work with different tech companies to pull together. There's often 3 or 4 different companies working together to create these. But in terms of overall efficiencies, we'd have to go back and look at the specifics of each one, but it's generally a data, the ability to have data to support the decision making that the city's doing.
Well, very quickly, Mr. Chair, when this does come, this is a comment. More than anything, I think we do need to see where those efficiencies were derived and what kind of saving. If council is asked to invest more in this, we need to know what we can get out of this. And my comment is we cannot approach it as a spaghetti against the wall and see what stick approach. We got to be more fine-tuned. I think work will have to be put into and effort will be need to be made for us to be more concise in pinpointing where issues or problems exist within a corporation that we're looking at technology to solve for the city of Kitchener. And I think further discussion about how that can be monetized as well. Thank you, Mr. Chair.
Thank you. Councillor Johnson.
Yes, thank you. And I'll piggyback on Councillor Singh's comments, but I'm going to take a little different approach to this, and that I am always so excited to look at what you're doing there. I know that you just won an award. You're on the multimodal counting piece. I know that you just came in and made that announcement at council last week. You are making differences in communities. You're making differences across the province. And I will tell you that whenever I attend municipal meetings is in another part of my life, that the city of Kitchener and this lab is held up in particular as something that is very exciting in the direction that other communities wish that they could take. So I kind of look at this from the perspective of it being a problem lab. I wasn't here whenever you were first given the funding. I think it was 3 years ago whenever I read in the report, but I do know that it's held up as a very innovative idea, as a place where those ideas can grow. So it's wonderful whenever we get money-making pieces from this. I think the exploration of ideas here is really important as well. So I'm excited to see a further report come back from you and to talk about the things that you're going to be looking at in the future. And that's not, Councillor Singh, that's not saying that what you just said is not important. I don't think that at all, but I think there's also some bigger picture work that I think is important to look at too.
Councillor Johnston, I agree with you. You just have a better way of saying it, a nicer way of saying it than I did. We are in agreement though. Thank you. Sorry for interrupting.
Thank you.
Councillor Marsh.
I just wanted to say thank you so much for all the work that you've done. This is amazing. The significant achievements that have been made by the lab is really extraordinary. I am particularly impressed by the augmented reality application for visualizing building models in a planning application. I mean, that will be a total game changer if we can find a way to make that more the way that just a way of doing business when we have planning applications come forward. I think, well, anyway, I look forward to hearing more in Q1 of next year.
Very good. Mayor Rabinovich.
Thanks, Chair Davey. And I just want to take this opportunity to thank Courtney, first of all, for her leadership over the last year and a half or so, the second half of the time that this pilot has been in place. And I think between herself and her predecessor, we've been able to actually have some real achievements in terms of initiatives that have been completed, as well as build an understanding amongst municipalities about the role that cities like Kitchener and others across the country, particularly those that are working in the innovation and technology space, play in this important area. I think the other thing that we don't want to lose sight of is the importance of partnerships and the interrelationship between what we're doing here and what we're trying to create from an economic development point of view in terms of technology and innovation, the growth of our clusters, and collaboration and partnerships with local technology companies along the way. You know, I can tell you that certainly I've participated in many tours, and I know there have been many more that I haven't been part of, but staff have been part of, whether it's other municipalities, other tech organizations and so on, who have come here and have marveled at the fact that not only are we as a city doing what we're doing under Courtney's leadership and Dan's as the department head, and others who have collaborated with it, but you know, not only marveling at the role that we've played there, but how we've collaborated with our partner Communitech on this, and the importance of that, and quite frankly, people looking at it and saying, how can we replicate this in our own city? And you know I've had the mayor of Halifax here over the last 3 years, and he's toured. I know I've had the mayor of Edmonton here, and he's toured, and many others. And I really think this is something that we can build upon going forward, and that you know, I understand where Councillor Singh's coming from. I mean, I too, you know, if there's opportunities to make money, that's great, but that's not the main piece of business that we're in. And there's a lot of value in us being able to, you know, either improve services, improve the connection with our citizens, and quite frankly, improve the collaboration with the private sector, which allows us to see them thrive and succeed. And ultimately, if they thrive and succeed, we thrive and succeed. So while we may not make direct revenue from it, we make indirect revenue because they're creating jobs that you know, pay taxes, that you know, buy houses or rent houses or apartments or condos in the community, and we benefit through that. So there is that sort of whole correlation that we want to keep in mind as we go forward. So thank you for the great work that you and your team did. It looks like Victoria wants to jump in and say something, and I look forward to the report that'll come back in Q1 to talk about how some of that collaboration can continue.
Ms. Robb?
Thanks, through you, Chair Davey. I just did want to emphasize what the Mayor just spoke about there, which is customer service. And so we've talked a little bit about monetizing, and we've talked a little bit about prototyping, but I really can't underemphasize or overemphasize the importance of customer service and the value that the lab drives there. So with the pandemic alone, for instance, if it weren't for the lab and the participation of the digital transformation team internally, we would not have been able to turn around creating an online booking process for the myriad of programs and services available at the city in the midst of a pandemic. So that was one key initiative that they drove and that they delivered. The other is the behind the scenes tracking of staff health and availability for their shifts. And so in the matter of days, not weeks, not months, they've created an entire system in the back end of the city's infrastructure that tells us on a daily basis what our staff's health is, whether they've called in sick, and allows us to forecast and provide to you things like the attendance monitoring to let you know what our staff wellness is in the midst of a pandemic, so we can forecast whether or not we may be in a staffing crisis down the line. And I think finally, the last thing that was touched on was some of those counters, right? They might just be small pieces of physical infrastructure counting the number of dogs in a dog park, but we can't underemphasize the importance of data and being able to provide you one more touch point to look at when you as a council are making decisions that impact the day-to-day life of citizens, whether or not they want or need a dog park in their neighborhood, whether or not they need multimodal infrastructure on their street. This is new for us, and it is, as evidenced by that Smart Cities Award, transformational when it comes to building a city that's both smart and livable.
Pardon me, my mic was off. Could I get someone to move this item? I don't have a mover yet. Moved by Councillor Galloway-Seelock. There's no one else in the queue. I'll just make my comments briefly, starting off by my thanks to Ms. Zinn for her leadership and role in this. You know, the pandemic threw everything threw us for a loop, and we're lucky to have that resource there. But I really do see this tiny little aspect of our corporation as the one with the most potential. And I'm going to meet with staff offline between now and when this comes back in Q1 to voice some of my opinions as well. And I would encourage other members of council to. I really see this as the one little section that can look inward as well. Mayor Verbanovich talked to a lot of the outward stuff, but we can also look inward. There's no one. I think there's a lot of problems in municipalities that are solvable with technology, but we just don't know they're there. So a grassroots approach in our own organization to filter up, to highlight some of these things. We don't know what the solution is, but this is the problem, and looking at how we can apply technology to solve them. So that's what I'll be looking for when this comes back. Anyway, it's been moved by Councillor Galloway-Seelock. I will take the vote. Those in favor? And opposed? Not seeing any opposed. Very good. Thank you, everyone.
What was the vote on? I thought it was just an information item. So there's no direction being given, right?
Yes, it was to be received for information in that staff report back in Q1 of 2021. Okay, so that concludes this portion of Finance and Corporate Services Committee. We do have the public input session. Let's begin that in 6 minutes at 5:10, if that's okay with everyone, only because we have delegations waiting, okay? Mr. Bunn, we do not have to log out of this, right?
You don't have to log out of this, but you do have to finish up with the CISC items and then special counsel as well.
So we're not going to do that. I don't think we can do that now because we've got delegations waiting.
Yes.
I know there is. I know. Getting some input from folks that there's some fatigue. Some Zoom fatigue today, but there's also some time sensitivity. Like I think the rest of CIS is fairly quick, and the resilience funding is time sensitive, and then the rest is just really approving an all council meeting. So maybe we can do it. Would people prefer that we have a bit of a break and that we do that at the end of planning, maybe?
If I can interject just for 1 second, it might also benefit if there's an update in the number, because I only have 2 delegations listed for public input. So if unless there's been a significant bump, we can probably deal with all of them.
There's just still two delegates.
So if that helps, Mr. Mayor, in the decision.
So I'll ask council. I guess my question is: would you prefer to have a break and deal with it at the end of planning, or would you prefer to deal with it between finance and planning and have a shorter break? So I'll ask longer break. How many want a longer break?
What exactly is deal with it? Like, you talked about a number of things there, and I'm not sure what it is now.
So it is the anti-idling bylaw and the user fee reductions for red control restrictions. I think both of those are fairly straightforward. And then we need to approve the COVID-19 resilience funding because the application needs to be submitted. So that one has to happen today. So who's first?
Member Banovic.
Yep.
Why don't we have delegates for the public budget start, and once they're finished, take a little bit of a break there, and then pop right into the community services again, and then follow up. Probably have time to do before that. Maybe finish up the finance, and then after that we can go back into after that if that's possible.
No, well, finance. The rest of finance we're done.
Okay, well, then we should be done.
So that's my question: is do people want a longer break now and finish after planning, or a shorter break after the two delegations?
Short.
Shorter.
Most people short. Okay, so we'll do short.
That's fine.
Okay, so we'll take your 6-minute break now, and we'll see two delegations in 6 minutes.
Okay, thank you.